everyone. This is Coral, otherwise known as Luna's mom. We are back in the month of May for Brain Tumor Awareness Month, and today I have another brain tumor warrior parent.
Hey everybody, my name's Kaylene Foster. I'm the mother of Lovelynn Foster from New Mexico, and we did a majority of our treatments out in Denver, Colorado. So we did a little bit of the long distance thing.
Tell us who Lovelynn is and just tell us about her.
Lovelynn was she had kind of like an old soul. We're in New Mexico and a lot of culture around us. We're Navajo, and she has a little bit of Jemez Pueblo blood in her. So she was very traditional for a child. Loved our culture, loved the music, loved the dances, loved to paint, draw. She was very hands-on and liked to work with her hands. Had a great imagination. Like, she was non-vocal, so she didn't talk, and we had to kind of like learn her cues and her language, I guess. Very sassy. So sassy, which a lot of like her medical team had always told us, like, her sassiness is what's gonna get her through a lot of this, and it really did. She was very, very loving, caring.
Her forever ages too.
Yeah. So before diagnosis, she was still very liked to be in the kitchen, liked to be around me when I was baking. I liked to craft, so she would be right there with me while I was crocheting, making cricket crafts, painting, whatever it was we were doing. She was always just right in the middle of all of it. She was definitely a bright spirit.
That's beautiful to hear. And I always say you can see the kids through their parents and how they talk, that light and that brightness, and it definitely comes and shines through you. It's just beautiful to see, and I kind of feel that through you. What were the initial symptoms that made you think something is wrong with my child?
I think, like, from the very beginning, the thing that I don't want to think that, like, I always thought something was wrong, but my pregnancy with Lovelynn was a very different. I have 3 older girls, and with Lovelynn, like, as soon as she started to, you know, like, during pregnancy, you go in and you do ultrasounds regularly to check on measurements and all those kinds of things. Like, Lovelynn was considered high risk from the very beginning, and I never understood why. And to this day, I still wonder, like, did they know something that they just did not tell me? Because I had to do ultrasounds every 2 weeks with Lovelynn after I was 5 months pregnant, probably. And they would always tell me, like, oh, you're high risk. After she was born, she always had, like, a raspiness to her. She always had a hard time swallowing. She always had a hard time feeding, like, drinking. She would immediately throw up a lot of the time, and we were told, like, you know, that's just, she aspirated something, you know, and she's just trying to clear it up and all this stuff. And, you know, like, we heard excuses
with babies too. Doctors always go to, it's reflux.
And then they told us, like, maybe it's the formula she's drinking, she may need to switch formulas. So we tried several different types of formula for her, and finally we found one that made her, you know, more comfortable. She breastfed and formula fed, and with both, she had finally gotten to a point where she was comfortable and wasn't having too many issues. When she was 8, almost 9 months old, she had started to develop a droop on her eye. And then her raspiness had gotten worse. And we took her to a pediatrician and asked him, you know, like, this is not normal. Like, she's having a hard time, like, it sounds like she has something stuck in her throat, and I can't clear it. Like, I've burped her, I've tried, like, warm baths, I've tried steam, everything. I was like, and nothing's really seeming to clear her up. Like, she still has a lot of congestion, it sounds like. So then he, you know, like, took a look at her. This was during COVID. So this was really hard for us, because during COVID, we were stuck to either one visit in office, and that was just their main visits to take their vitals and stuff, and then the rest of them were over video. Which, you know, you can't, I think, unless you really know the child, you can't really diagnose anything from a video. And so a lot of these conversations were had through video. What are they called? Telehealth. He would take a look and say, you know what, allergies, you know, babies tend to get allergies, and it's that time of season. You know, she could just be dealing with a lot of whatever things were in the air. And I'm like, okay. So I kind of brushed it off. And then we started to notice she would, like, she liked the flash. I don't know why. Like, if you took pictures with her, she would laugh every time it flashed. So we would take pictures of her just to make her laugh. We would turn on the flash. And we noticed that one of her eyes would always close every time the flash would come on. And we're like, why is it doing that? And it wasn't both eyes, it was just the one eye. And so my sister, I had sent these pictures to my sister who doesn't live nearby. So she'd be like, why does she do that? And I'm like, I don't know. Like, we've just noticed that she just started to do that. And she was like, her eyes really droopy. You should ask her doctor about it. And so as we started to notice, like a couple of days go by and it started to get a little bit worse, and then it started to have a lot of discharge, we went to, or we called her doctor again, set up another telehealth appointment, and then he told us, like, I think it's just allergies. Like, her eye may be responding to some kind of sinus infection. As your sinuses flare up, it can, those nerves or that area is all attached to each other, and she may just be experiencing some symptoms of her allergies. And so we brushed it off again, and then she started to throw up in the morning. That was what it was. She started to throw up in the morning every morning. First thing she would do was to start throw up. And I was like, why is she throwing up? Like, I don't understand. I would, let her, get her all cleaned up, get her ready for the day, feed her, and then she'd be fine and would cry a lot. Like, she was very uncomfortable and irritable, and I didn't understand what exactly.
How old was she at this time?
She was 9 months old.
9 months old, okay.
And then so she kind of just, as the month, this all started in like August of 2020, we noticed, like, started to see the first symptoms of it. And then September, she slowly started to get worse. And then in November, we noticed that she was throwing up more often. She wasn't able to swallow. Every time she did swallow, she would start aspirating and choking, and like to the point where she was turning blue. We were like trying to figure out how to keep her like from aspirating and like causing any more issues. And so I probably made 4 or 5 visits to the ER with her, trying to figure out like what's wrong. Like, you can't keep pushing me away. Something's wrong with her. And like, oh, she has pneumonia. We're going to give you antibiotics. And then we would take her back in a week and say, okay, she's been on the antibiotics for a week. Nothing seems to be improving. What's going on? They would check again. Oh, it's just her allergies. They're getting worse. We're going to give you allergy medicine. And then so we went home, still on the antibiotics, taking allergy medicine, took her back in a week again. They said her pneumonia is back. We're going to have to put you back on antibiotics. And after like the 3rd visit, the 4th visit, I took her in. I had breastfed her before we left. She was fine. And then we got there and she wanted to eat again. So I gave her a bottle and she drank the bottle, no problems. We were in the emergency room, isolated from everybody else, and I was trying to like calm her because she was very irritable, didn't want to be, in her car seat, and I was trying to keep her safe. So I had her covered up in the car seat, like, you need to stay in there because, we don't want you to get anything that you don't need right now.
Especially during that COVID.
Oh, yeah. With a lot of people in and out of the emergency area too. And then she wanted more milk, but I didn't pack more milk because I packed the 1 bottle thinking it was going to be kind of a quick thing because she was basically irregular there at that point. So I breastfed her, and as soon as I started to breastfeed her, she started to choke again. Like, just, I don't know what it was. What the doctor had told us was that when she breastfeeds, she's using more muscles in her upper body to breastfeed, and it was harder for her to do so because it was putting so much strain on her. That was what was causing her to start choking and like making it harder for her to swallow. Once we got into the emergency room with a doctor, like she took a look and everything, and she said, well, I've noticed that her chart that she's been diagnosed with pneumonia. Like, when did you finish antibiotics? How long have you guys been on the allergy medicine? What are you doing at home to help alleviate some of her symptoms for her allergies? And kind of just all the basic questions. And I told her, like, we're doing everything that they've told us to do. Like, we've trying to follow the regimen as closely as we can to make sure that we can help her get better faster. She like tried to push it off and tried to say, like, what, I think it's just the pneumonia. We're going to extend your your antibiotics, or no, we're going to give her a break on the antibiotics and we're going to do, I don't remember what it was, like a steroid or something is what they had wanted to do. And I said, no. I said, because this doesn't make sense. It's like she's been getting diagnosed with allergies for 2 months now. She's been diagnosed with pneumonia 3 times now. It clears up and it comes right back. Well, because she's choking when she eats. Okay, then why is she choking when she eats? Because this doesn't make sense to me. If she's having a hard time just doing the basic action of eating, like that doesn't make sense that she can't just do that. And then I told her, I was like, well, we've noticed that she has a droopy eye. They told us that that's because she has a sinus flare up. But if you look in her nose, there's no sign. Her nostrils don't show any signs of sinus flare ups. And she was sleeping when the doctor was talking to me, and eventually she had waken up and she had like a very raspy, kind of like a mucositis type sound to her. And I was like this sounds worse than it has in weeks. I had this weird instinct, like something has to be wrong. I said, because there's no way that this is allergies. None of my other kids experience allergies like this, not even at this young. None of my kids have ever had pneumonia, and they've never had pneumonia back to back the way that she had. So I had told her, I was like, with all of these other things on top of that, like I'm not leaving here until you can tell me what's wrong with my daughter. I said, I'm sorry. I mean, you do what you have to do. I said, but you need to tell me what's wrong with her because this is not normal for her. So finally she had seen that I was like adamant that we're going to figure out today what's going on. So she said, okay, well, let's wake her up. So I turned Lovelynn over on my lap and I showed her, like, turn and look at the lady. And so she turned and she looked, and I guess at that point her eye, the one that was droopy, had started just kind of roaming on its own. And she was like, has she always done that? And I said, done what? And so I turned and I looked at her, and she looked fine to me. Like, I didn't notice her eye was doing that. And then she said, hold on. So she went and got a flashlight, and she was kind of like doing the little eye test on her, and the one eye was not moving along with the flashlight. So she said, okay, we're gonna need to do a CT scan. She said that's gonna be the most available option we have right now in an emergency situation. So let's get her back for a head CT and figure out what's going on. And so I said, okay, like whatever, if that's gonna help us figure out what's going on, then let's do that. So they did the head CT scan. This was like 1 a.m, probably. Like midnight. They did the head CT scan and gave Lovelynn back to me. I put her back to sleep, and then she had come back in and she had told me Lovelynn has a tumor on her brainstem. And I mean, as most parents in this position can relate, like, you just can't believe what's coming out of the doctor's mouth at that point. And I kind of sat there, and, and it sucked because I was by myself, and they basically said, like, we don't have a pediatric department here. We don't have anybody that can do anything right now. So we're going to get you guys loaded up, and we're going to transfer you to the children's hospital. That way you guys can be admitted tonight and have surgery tomorrow. And I said, what?
It just kind of threw everything at
Yeah.
you. It must have been really hard, especially being just you in there by yourself with her. Must have been hard to process all that.
Yeah, I think anyone in our position, we kind of get an idea of what's normal for our kids, what's baseline, and what's not. And I think, like, after the second pneumonia, I'm like, this is not right. Like, something's wrong.
It's unfortunate that we're dismissed so much by doctors.
Yeah.
And this is what it's in Luna's story and every story that I keep hearing, parents kind of knew that there was something wrong with their kids, and they're just being dismissed time and time again. And essentially that's, time that it could have been caught earlier.
Yeah. And that was the thing that kind of bothered me the most, because it was kind of like, we knew something was wrong. We had brought it up that something was wrong, that this wasn't normal for her. And, after 2 emergency visits and 2 telehealth visits, you would think somebody would have raised a red flag and had said something like, hey, let's look into this, because this isn't this, especially after the second diagnosis for pneumonia. We figured that they would have like looked a little bit more. you know, like she had been COVID tested, RSV tested, like everything, every single time, and just nothing was coming back positive. So it was frustrating because, you know, we were over here trying to figure out what was wrong. How can we help her? How can we like get her to, you know, eat without throwing up her food every single time? Her doctor, you know, he called after Lovelynn was diagnosed, and I guess he had seen in her chart, I don't know what warranted him or what flagged him to check her chart, but he had saw in her chart that she was transferred to the hospital and was told that she had the tumor on her brainstem. So he called us when she was in surgery to get her tumor removed, and he said, hey, he's like, I wanted to call and apologize. He's like, I didn't mean to brush you off. I didn't mean to you know, overlook the symptoms. He's like, but you know, it's hard. It's hard in this setting to diagnose anything because we can't see her physically and we can't do like a physical look at everything. He's like, so, and I told him, I said, you know, I was like, I appreciate you giving me a call. I said, but at the end of the day, like after sending us to, you know, intensive care and ER as many times as you did, like something should have clicked somewhere.
Essentially, you felt some guilt
Yeah.
in brushing you off.
Yeah, and he apologized and said, you know, like my wife was diagnosed with cancer. She, you know, she went through treatments, and you know, I probably should have listened to you when you said that you knew something was wrong. I was adamant this last visit, and I said I'm not leaving until you tell me what's wrong. I was like, and you know, to them telling me that she might have cancer is not what I was expecting to hear at all.
Although you want answers, like that's not what you want to hear. You know, it's kind of discouraging when you keep going and they're like, oh, it's this, it's this, and they can't figure it out. But you never in your life want to think that it's a tumor or that it's cancer.
Yeah. And I didn't like that wasn't even what I thought it was. Like I was hoping that they were going to come back with the head CT and say like, oh yeah, her sinuses are very inflamed and you just can't see it. Like that's what I was thinking. And so to hear a tumor diagnosis was definitely not what I was expecting at all when they came back.
That must have been it's really rough, and I've been in that place where you're like, what? Like mean, like, and I don't know for you, but for us, they called it a mass. They didn't say tumor right away. There's a mass. We see a mass, and it wasn't until they did the MRI that they're like, okay, it's a tumor. But it's very hard.
Yeah. The way she told me it was a tumor. She said, I can't say that it's cancer. She's like, but I also can't say that it's not cancer. So we need to get you out of here right now, and we need to get you over to schedule surgery. And I was like, what? And just hearing that, you know, like your little 10-month-old baby's going to have to go through an extraneous surgery, like you just can't wrap your head around it. And I was just like, I remember as soon as she told me that, she said, I'm going to give you a moment. Whoever you need to call, you need to have somebody come pick up your car. I was like, yeah. What? And so like I called my husband right away, let him know, and then told him that he needed to reach out to his parents. I called my mom, just telling her, what am I supposed to do? Like, what? How is this happening right now? Like, I don't understand. And all of this was like a hard time because my dad had just passed away a couple weeks before Lovelynn was diagnosed. And we weren't able to go to my dad's funeral because Lovelynn had pneumonia at the time. And so we were kind of in that space of like, we need to stay home because we don't need her to get even more sick being out in the dust or the wind or the cold or anything. Like we need to for me, it was more, I need to take care of her right now. Like, you know, I can go and visit my dad when I'm ready to. I said, but right now, this is
baby was your, you know, the safety of your baby was your priority. Yeah, of course. Wow.
So that was all difficult, very difficult.
All in the time of COVID, and I think we all felt how hard that time was, especially like in the middle of lockdown and all that stuff, and then your dad, and then this. I'm sorry.
Yeah, it was a lot. It was a lot to really wrap like my head around and really kind of like understand that it was really happening, because a lot of the time it felt like this can't be real. Like, this can't be really happening. Like, when am I going to wake up?
Yeah, it's like a shock. It's like you hear it, but you don't want to believe it, and it takes time to process. So she was transferred to the Children's Hospital, and is that the one in Colorado that you said that you were at, or was that a
There,
local one?
she was transferred to the local children's hospital. And she had her section surgery done here in Albuquerque. And then she was here she did 3 rounds of ice treatments, I believe, here. And then they had already told us, like, in the very beginning, that with the type of, when she got her after her surgery after her biopsy, they had told us, like, she has ATRT. It's not something that we can or not something that we can treat here. We're going to do your initial rounds of chemotherapy here, and then eventually she will have to go to Denver to have transplant, so bone marrow transplant done, and then radiation as well, because we don't have a radiation center here that treats pediatric patients. So we did, just November, the end of November, December, and then the middle of January was when she was transferred to Denver for bone marrow transplant.
I can imagine, with her being her 4th child, how difficult that must have been with, having your other kids. And did you have support through this?
Yeah, I think, like, COVID really did make it a lot harder for all of us. At the time, all the kids were in distant learning, so that definitely helped us as far as, like, making sure they were going to be together and they were going to be able to support each other. And then my husband's job at the time, they weren't, like, it wasn't an easy option for him to just kind of get up and go. For me, I already was in a position to where I could kind of just go if I needed to. So that helped as far as, like, making sure the household was still taken care of. And then I have a niece who, volunteered, said, I will come and I will help you take care of. Our youngest at the time she was 7 or 8, something like that. And so she, we needed to make sure that she was going to be taken care of. And my niece at the time said, you know what? I can come.
Yeah.
Let me come and you guys go take care of Lovelynn, and I can take care of Angelique for you guys. So luckily, we had people that were in a position to be able to come and, be a little bit of an anchor for us, because that was definitely the hardest part, was trying to figure out how our youngest is going to be, taken care of while we just kind of drop everything and go. So that helped, because we definitely needed extra support when it came to having to pick up and go.
So did they stay in New Mexico and you guys traveled there, or did they go with you?
Yeah, they stayed here and then we went. A majority of our stay in Denver was just me and Lovelynn. My husband came, he did his FMLA leave and did his 3 months with us. And then luckily he was there during the whole bone marrow transplant, so he got to be there and support us through what I feel like was the hardest of all of it. And then after her bone marrow transplant was done, he basically had run out of time, so he had to come back to New Mexico. They still came out, like, every weekend or every other weekend, or anytime Lovelynn was like, hey, I need my dad. He was definitely in the car driving out as soon as he did. Because there were some weekends where he didn't even plan on coming, and she was just like, I don't want my mom. I don't want anything. I want my dad. And so I'm like, you have to come out here. And he was like, Kaylene, it's 7 o'clock at night. You need to come out here. She doesn't want anything.
And how long is that drive from, how long is that drive?
6-7 hours? Yeah.
That's a long drive. And he did it. That's amazing.
Yeah, he would, like, say, okay, I'm just going to drop it. And we told him, like, don't take your clothes home. Leave some of your clothes here. That way, if you need to come, you can literally just jump in the car and come. I think the best thing about being in Denver was that the way the team there took care of us, we had our own little apartment there that was fully paid for. I believe insurance paid a majority of it, if not all of it, but the foundation that provides that housing, they took really good care of us. So it definitely took a lot of the stress off of our plate. And when our kids were ready to come out, they were able to come. It was a cute little 2-bedroom apartment. with all the amenities, and you know, the kids had their own room. We were able to like
Be
make
comfortable
amends there. Yeah.
in an environment that was completely different than
Hmm.
where, than home. Yeah.
Yeah. So they were able to come out for spring break. They were able to come out for summer vacation, because we were out there from the middle of January to, let me see, she ended treatment in August. Oh no, she ended treatment in July, and then she had a relapse in August. So then that extended our stay for another 2 months. So we didn't fully move back from Denver until October. So we were out there for almost the whole year.
That's long.
Um, yeah. And I mean, we made trips home. Like, if they gave us clearance to, we
Yeah.
made trips back home. So that way she could remember, like, you
Yeah.
have a home. This is not your home.
Mhm.
Because she really got comfortable there. She
Mhm.
would lay in the dishwasher. Just, she ruled that house. So we didn't even, like, she was so comfortable there. And so when she'd come back home, she was able to, like, get into her toy box, draw on the walls, like all kinds of stuff. And we're just like, ugh, like even to this day, like we still find little things that she's
Oh.
planted places that we're like, how? It's been 2 years. Well,
Yeah.
almost like it seems like three, because when she got closer to the end of her battle, she had lost mobility in her legs. Like, she was basically, the tumors on her spine made her like paralyzed from the waist down, so she couldn't move her legs anymore. She could like army crawl, but she would
Yeah.
get so frustrated, like, and tired very quickly. So we were like her transportation. So she knew how, she had her little blinker. She knew how to tell you which way to go, when she wanted to go. Yep. Like, you would just hear her, and she would just start pointing, and you knew, like, okay, we got to get her and go, because she's ready to get out of here. Um, Before, when she was crawling and moving and everything, like, she would put crayons in the outlets. Um, she had this weird. The kids would make slime, and they would
Mhm.
put in the little tiny foam balls. And
Uh-huh.
she had
I
this
see
thing
that.
about collecting the foam balls.
Oh.
I don't know how she knew where they were all the time, but she had a little cup that she would just collect them all in and crawl around the house with it. And so, like, to like this day, I think we still find little foam balls everywhere, crayons in the outlets, earrings in the outlet, which I don't know how those got in there.
She
Um,
found a way. It's like little, I feel like I take those like a little signs, like,
yeah.
sometimes you're like they're just kind of continuing to sprinkle those things, and
Yes.
but I know exactly the foam balls. I know exactly what you're talking about.
Yep. And then she collected mini brands,
Mhm.
and I we still find mini brands just sitting around everywhere. Her sister was really big into Legos, and the Lego sets that she would get would have like little tiny cell phones, little tiny
Oh,
laptops, treats, carrots, like these little tiny things. She was obsessed with the little tiny things, and I
that
didn't
was too. I
understand.
don't know what it is. She would always want the little laptops or the little phones. Yeah.
Yeah.
And then when she would lose them, she would go crazy, like, find them.
Yeah, and I don't. She lost. We had like three of them. I don't know how she would lose them and still find them back. Like, you would pick her up, and then she'd be sitting there holding with her two little fingers. Like, how do you still have that? Like, I don't. We lose. I don't. She had this for when she was in bone marrow.
Mhm.
When she was going through a bone marrow transplant, she
Mhm.
had this thing about gift cards. I don't
Okay.
know what it was. Like, she always had a gift card with her, and
Hmm.
then she would lose them, and then we'd have to like go find another gift card to give to her. I don't know how many of her dad's Costco cards she's lost. We still haven't found any of them. We don't know where they went. So for all we know, somebody's using it somewhere. um Gift cards. And then after that, she went through this phase of spoons. It didn't matter what kind of spoon it was. She had to have a spoon in her hand. She'd sleep with a spoon in her hand. She'd wake up with a spoon in her hand. And but she wouldn't let anything go in her mouth, so we never knew why she carried
Yeah.
around a spoon with her. And then we went through a phase of mini brands. She'd always have one specific kind of mini brand in her hand, and it's like, what is it with you and this
Yeah.
bottle of Stubbs barbecue sauce? I don't understand.
What is it? Those are cute. Luna like to collect those too, so they're actually addicting. They're like, to just
Mm-hmm.
look at them, they're just cute because they're miniature.
Yep. And
Yeah.
so I think it was for her second birthday. We that was like one of the things that were on her wish list, and she
Mhm.
got so many of them. Every time she'd see them at the store, we'd have to buy one. I don't know what it was. It was something about all these little tiny things that she just had a weird obsession with. She just loved them so much.
Yeah.
So we still find so many of those things just randomly, and feeding tube ends. I don't
Feeding-
know.
Oh, okay. Interesting.
Yeah. It's like we have a little collection of feeding tube ends that we just find
Mhm.
randomly. Like, what are we still finding these for? Like, Lovelynn, you need to stop stashing these places.
And then as you find them, are you still finding yourself still keeping them?
Yes.
Or yeah,
Yeah.
or just
Yeah. We
hard.
have a
Like
little.
I find stuff too, and I was like, I'm just gonna set it here.
Yeah. Yeah. My husband has a little place where he puts things for her, and he's just like, found it. I'm like, okay, put it with the rest of them.
That's
It's
beautiful. Like she's still around.
like, it definitely like warms us when we find little things like that.
Mhm.
Like some people are probably like, ugh, well, how do these
Mhm.
get here? But for us, we're just like, okay, we found another one. I
Yeah.
don't know where else you hid the rest of the Easter eggs, but we're gonna find them.
Sure.
She's definitely missed so much. I think it's like just it's hard to like really grasp your mind around all of it, because it's kind of like, why, like I think that's kind of the thing that I run into all the time is why her, or why did we have to go through this? And it's just kind of it's hard to really like understand all of
Mhm.
that.
Yeah.
But at the same time, it's like, like I try to think on the brighter side of all of that. Like, we learned a lot from just the battle that we went through with her, and like how I think, like, in a way, she kind of she made us so much stronger, because, like, you would never think that you'd be able to survive something
Yeah.
like we have all gone through, as far as like losing a child, one going through cancer treatment, and being away from our family the way that we did. She definitely like taught us a lot about trying to be stronger for ourselves, because I think that was the hardest of all of it, was trying to like, how do I keep a bright face, even though, all of this sucks and I hate that we're going through this. Like, how do I not show so much of that, like anger or sadness or like disappointment?
Present for them and
Yeah. Yeah. And she was like, she didn't like people to see her down. When she was going through bone marrow transplant, like there were days where she was just so like, you could tell she was so exhausted. She felt defeated. She felt like um just not in the energy to do anything. If she was hurting and was in pain, she would cry to me and her dad. She would kind of like just lay with us and didn't want to be touched,
Mhm.
didn't want to be bothered. But
Mhm.
as soon as somebody walked in that door, she would smile. And it was just like, you weren't smiling like a second ago. What are you smiling about? She didn't want nobody to see her like down or sad or in pain, nothing. And then as soon as they walked out and the door shut, she was back to like whining and uncomfortable, and like, and we're just like, ugh. And she kind of stayed like that through all of it, like even to the very end. Like she really like tried to like dance. Like her last day, we didn't know it was going to be her last day. They had told us, like, you have a couple days to a week left. And so we're like, okay, like, what does that mean? Because, and for us, we were kind of like, she's always been very like telling, so you can kind of tell like how things are going with her, how she's feeling. And um the night before she passed away, we were up till like 2 in the morning watching movies, drawing on the iPad. A couple of her nurses came in to see her that were there with us from the very beginning. They came in, they visited with her. picked on her because they know like she's very bossy and like they just like to like push her buttons just to make her like, hey, leave me alone.
Let that sassiness come out.
Mm-hmm. Yep. So they kind of just messed with her a little bit, and she just like, you need to get out of here. And her thing was like, if she didn't want you around or she didn't want to deal with you, she would immediately start blowing kisses. So when we were in hospice, if her hospice nurses came, she'd be laying there and she'd look over to see who it was, and if she saw who it was, she'd immediately get out of here, get out of here.
That was her like sign. Okay, bye.
Yeah. Mm-hmm. I saw you.
Oh,
Bye. So she would immediately blow kisses like, you need to go, I'm done with you. Like, they just got here, Lovelynn, they haven't even done anything yet, and she didn't want it at all. It didn't matter. Like, there were certain people she'd be like, okay, you come pick me up, but then there was other people where she just saw them and immediately would start
like,
blowing
no,
kisses like, get out of here. Yep.
that's
You could really tell like what she needed or what she wanted or how she was feeling, even though she was nonverbal. Like when we see other kids' stories and like what they're going through, I'm like, I don't think I would have ever been able to do this if my kid could talk. Like I see like these little kids and I see it and I'm like, ugh, I can't even imagine if Lovelyn could have told us how she was feeling. I can't, like, that's like the hardest of all of it is like now you see other little kids go through it and you're kind of like, is that how she felt? Like, is this what she went through? Like, she could never tell us. Like, she couldn't verbally say how she felt or what she was feeling. And we see other kids, and it's like, wow, like, I would have not been able to. The day that she passed away, she danced. She kind of sat there and, like, just hung out with her sisters. And, like, I knew, like, part of me knew, like, it was going to happen because it was just me, her, and my husband in the hospital with her. And I don't know, like around 11 o'clock, I told him, I said, we need to get the kids here to say goodbye. And he kind of looked at me and he said, why? And I was like, I don't think she's going to make it through today. Like, she doesn't, I mean, she seems like she's trying her hardest to do a lot of things, like, but her energy is running out and you can see it. Like, you could slowly start to see her go pale and all of that. And I said, no, we need to get her sisters here. So he went, picked up the kids. My mom was staying with us at the time. He picked up my mom, brought her over. He called his family and told them, if you want to say, your goodbyes to her, you need to come do it now because we don't think she's going to make it through today. But, when her sisters got there, she laid on the bed, danced with them. They sat there and they talked to her and they, laid with her. And you could tell that she was really trying her hardest to just be present because she was still trying to do a lot of the stuff that she would normally do. But I was like watching the monitor. Like, I asked them to keep the monitor on because I kind of wanted to know, like, in our culture, the kids aren't allowed to see like her gone like that. They're not, they can't experience that. So I wanted the monitor on so I could kind of monitor her and see, how far, how much she was declining and how rapidly. And we had gone to a point to where I was like, okay, I went over and I laid down with her and I was telling her, like, if you're ready to go, you can go. Like, don't wait around for me because, like, if you're tired, you need to go, then I'm going to be okay. Your dad's going to be okay. We're going to be fine. If it's time for you to go, you can let go. And it was so hard because she really did fight like the very last of it. And it was like, what the heck? Nobody told us it was going to be like that. Like, they kind of told us like it would be kind of like an easy transition. Like, she would kind of fall asleep and that would be it. And she did not. Like, I think she like really tried to like, and I had to tell her dad, I said, you need to take her because you guys need to. And I think it was at that point when I got the kids and I told them, let's go. I gave her to her dad and then he said, whatever he had to say to her. And then she finally let go. And it was like, I just saw the heart monitor stop. The nurses that kind of knew her that were watching from the outside, they're all like, yeah, she really put up a fight till the very end. She was trying her hardest to just hang on for as much as she could. We could see that she was declining and she was declining very rapidly because he had went, and I think the kids probably spent like an hour and a half with her before she passed.
Did they know what was happening or what was going to happen?
We had told them the night before, because that was when the night before, the day before she passed away, she was transferred over back to the oncology unit. And they had told us, like, we're going to take you out of the PICU and move you back up to specialty care. And because she couldn't pass in the home or anything like that. So we opted to do it at the hospital.
Okay.
And so the floor director, she was like, yeah, whoever needs to come, like, you can tell them to go ahead and come by. And then, we'll just keep her as comfortable as we can until she's ready to go. And we're like, okay. And so we had told them, that they had told us that, she's nearing the end. We have days to a week. We don't know how long it's going to take. And we're just right now going at her pace. Whenever she's ready to go, we got to say our goodbyes to her and let her go. So they understood. And I think just like the way we felt, like they couldn't really believe that it was really happening, because she was so strong and so like vigilant, almost like she was very like adamant. And so all of us really believe, like, like she's fine. She's going to be all right. So that definitely made it harder, was just like, you see her be so strong all this time, and to see her weak like that was hard, especially the last couple of months of her life, because we slowly started to see the decline. We have never seen her like that, like where she kind of needed somebody to do a lot for her, because before she was very much like, I'm going to put my own medicine and I'm going to do this myself. And it's like, girl, give me your medicine. Let me do it for you. So she really tried to do a lot of stuff herself. And I think, like, I don't know if you like experienced, like, but they watch so much of what the nurses do that she was like, I could feed myself. I can give myself my own medicine. Give me my hep lock. Let me hep lock myself. Like, girl, give me all of that. Let me do it. When we were outpatient, like I think that was probably one of the most scariest things for me, like leaving the hospital to be outpatient. I was like, how am I supposed to do any of this? Because like she had 2 Broviac lines on both sides of her chest, a feeding tube. And it was really like, okay, gotta hep lock both lines, gotta flush them every day. I gotta give her all her medicines around the clock. I gotta feed her. Like,
You become a nurse, and that's something a lot of people don't talk about. Like, you get thrown into this world and you know nothing about any of this unless you're already a nurse, but you know nothing, and you learn to do all these things that you only see usually nurses and doctors do.
Yeah, and like I thought, like, in my mind, like, they're probably gonna send like somebody over to do all this for her, right? Like, I don't have to do all. And so when they came and they had somebody teach me how to do all these things, I'm like, oh, I gotta do this? What? And then they're like, oh, we're gonna get you a pump machine to take home. We're gonna get her oxygen. And I'm like, what? How am I supposed to do all that?
And it's like a quick class. It's not even a class. It's like a quick, just do this and that, and then they expect you to be able to do it time and time again after that.
Yeah. I think the hardest one was adjusting to her medicine schedule, because she was on so many different medicines that, like, some were 4 hours apart, some were 3 hours apart, some were 6 hours apart, some were every 12 hours, some were.
Did you write it down, or how did you manage to keep?
I made like a little chart in Excel, and then I basically blocked out the times, and then me and my husband would text each other, like, even if it was just to like say, hey, Tylenol 4 o'clock in the afternoon, vitamin 12 a.m. That way we knew, like, the vitamin had to be taken every 24 hours, so we would give that to her every 24 hours. And then, like, that way, like, if he gave something and I wasn't home, then I knew what time he gave it to her last. Or if I was home and I had to go, because I worked at night when she was outpatient before she got put on hospice care. I worked at night, and so I would have to go to work at 4 o'clock in the afternoon, and I would get off at midnight, and he would have to take care of her. So I'd have to be like, hey, I'm getting ready to leave the house. I did this, I did this, I did this, I did this, I did this. Her oxygen tank should be full in case you need it, like, just whatever he would need.
Yeah.
And then I'd say, I turned off her feeds at this time. She still has this much to go. And like, it's so crazy, because our youngest now, she was like our little nurse too. So she knew like, okay, we got to text mom and tell mom what time we did this. We got to text mom, let mom know what time we turned off her feeds. Mom, I'm going to bed. You may turn her feeds back on before when you get home. And I'm just like, oh my gosh. And so she knew how to prep her medicine. She knew how to get her feed ready, hook her up, get her started. Like she definitely, like I always tell him like I don't know how we would have done any of this without her, because she, like, on those days we were so like low energy, because I would, the good thing about like my job working at night was that I didn't have to wake up like early in the morning to do anything. Like if I wanted to sleep in all day with her, I could,
Mm-hmm.
because this girl was a night owl. Like I go back through my camera, and I watch videos, and I'm like, 4 o'clock in the morning, we were baking a cake. What?
Wow. She was a true night owl.
Yeah. So we were like, I have so many pictures and videos that are like past 2 or 3 in the morning, and it's us like watching uh Coco for the 5th time that night, or we watched a whole marathon of Coco Melon, like just random stuff like that. Like, how were we up so late? And now, like, I think after she passed away, it took me a while to get back on a normal sleeping schedule, because my body was so used to being up like all the time that, like, I think for that whole year and a half that she was in treatment, my body was used to like 4 or 5 hours of sleep. That was my normal.
Yeah.
Some, like, because some nights they just, I mean, especially when you're inpatient, like you don't sleep. People tell you like you need to get your rest. How? I think that was like when Lovelynn had this thing about like strangers. Like she didn't like new nurses, she didn't like new techs. Like she was, she had to have like a regimen when it came to doctors. So
Mhm.
when we were here in Albuquerque, they had made her like a designated team. Like these people were her people. They were going to be the people that took care of her. And they kind of just rotated them as they were scheduled. And then we got to Denver, and she saw a different face every day, and she would just like, I don't want nobody in here, don't touch me. She was blowing everybody kisses as
Okay,
soon as
I
we
was gonna.
walked in. Yeah. And then eventually, like, I told them, I was like, she's in Albuquerque, this is what they did. And so like, okay, we can do the same thing. We had a palliative care or specialist, is that what they're called? But she came in, and she was like, you know what, like, let's, how can we make her more comfortable, because she seems very like uncomfortable and agitated. And so I told them, I was like, well, in Albuquerque, this is what they did for us.
Mhm.
I don't know if that's an option here. I was like, but that definitely helped her, because she got used to seeing the same faces all the time, and that gave her so much comfort, especially at night when I'm sleeping and she gets waken up by somebody. She wants to see, know who's waking her up. And if it's somebody she doesn't know, she's just like, I want my mom right away. And then that's when those nights that I don't get no sleep, because I have to go and like rescue her from stranger
Yeah.
danger, because she was definitely like, I don't know this person. And she knew how to hold her breath to make her stuff start beeping. Well, so
Oh, wow.
she would immediately figure out some way to make something beep to get me up, and I'm just like, okay, I'm up. uh,
So
she,
she would hold her breath to. Oh
mhm.
wow, she
she,
is
yeah,
smart.
she figured out her ways to like just get something to make some kind of noise, and it's just like, okay, I'm awake. When we first got to Denver, we slept in the recliner together like for probably a week,
Wow.
just
Okay.
snuggled up and trying to
Mhm.
get as comfortable as we can,
Mhm.
because she would not get into the crib at all. She was just like, nope,
Nope.
I'm not getting in that crib. I think like towards the end of her treatment, we had gotten to a place to where she was sleeping with me on the bed, on like my little pull-out bed.
Mhm.
And we're like, she doesn't even need that. She doesn't even need that anymore. Like she's sleeping right here with me. Like it's fine. And then when we came back to Albuquerque, when she did have to stay a night in the hospital for like chemo or something,
Mhm.
um, they would give us a regular bed, and her and I would sleep together on that.
I was
But
just gonna ask why they didn't provide you just a bed instead
yeah,
of a crib. I know she was small and I know a fall risk and everything, but I think when the parents there, the rail and it just makes
mhm.
it easier.
Yeah, I don't. I mean, like, should we in Denver? They had like a little couch that pulled out into a bed,
Mhm.
like a little pull-out bed, and it wasn't uncomfortable. And so, like, I would make that as it was a bed all the time, and we would just have all her stuffed animals and pillows and stuff on there, and then we would like nap on it and everything. And then sometimes she would just get, she was so comfortable, like I would put her on the inside, that way it was between me and the wall, and she only had one other way to go. And she wasn't very like let me crawl off the bed type of kid. She was kind of like, I'm going to bed, my mom's right here, I'm going to bed. So eventually they like stopped like pushing us to put her in the crib, and they kind of just like, we just want her to be comfortable, and if she's comfortable laying next to you and you can like make sure she's not going to crawl off the bed, then fine. And so we would like put barriers all around the bed where she was laying, so she would have to like wake me up to actually get over something. Yeah, she was definitely a boss. Like she made sure people did things the way she wanted it, and she was,
it sounds like she ruled whatever room she was in.
Yep. And it's funny because both teams, well, her team here, her team in Denver, and then her hospice team, all of them are just like, no, it's Lovelynn's way or no way. Like that's just how it goes. Like pretty much. Pretty much. Like if my husband has any kind of inconvenience now, he's just like, really, Lovelynn, I'm trying to be good, please. I told him, I was like, she's still picking on you, huh?
And can I ask, did Lovelynn know what was happening? I know I asked if the siblings knew, but did she know that she had cancer?
I don't know. You know, like that's hard to say, because I think like going to the hospital is all she knew. Like since she was a baby, like going in every week was normal for her. I mean, like we have, my husband has a granddaughter that's the same age as Lovelynn. They were born 2 days apart. And so she would come over and Lovelynn would kind of be like, wait a minute, she don't have this, or you could tell, she could see that there was something different between the two of them. And she kind of would get like, not irritated, but kind of like, I want to go back to my room. Like, I don't want to be out here. And so it was hard for us because we kind of wanted her to have that relationship with her and like see what playing with other kids was like. Because when we were in the hospital, she, you know, like she could have friends and she could wave at them from afar, but like they weren't allowed to like commingle and play like that. Because like obviously like we're in a very, very confined area. And so when we did get home and we did get to see her, she would be like, no thanks. I'm cool with seeing her from a distance like I see everybody else. So I mean, like you could tell that she could see that there were differences between them, but I don't know that she knew anything other than what she was doing every day.
She was, I think, so little that it was hard to like even talk to her, I guess, to try to explain that to a child. Did you guys ever have any, I don't know if they have that everywhere, but like a child life department that helped you guys? Okay.
Yeah, the child life, they were kind of there for us through the end of everything. They had offered to come out to our home and do crafts with the kids. The hospice team kind of had their own little group of people too that included the kids in everything that they did. So, you know, like if Lovelynn had music therapy, all right, everybody, music therapies on Tuesdays and Thursdays. If you want to come sing The Wheels on the Bus 50 times in a row, come by.
Was that the song she picked?
Yep. So it was The Wheels on Bus on repeat forever. Everybody knows when they hear The Wheels of the Bus, like, oh my gosh,
Lovelynn.
Yep.
And that's such a beautiful name, Lovelynn. How did you name her?
We were looking on Pinterest for names. Like we were trying to decide, like, what do we want her name to start with? Because our oldest name, my husband's son, he has an older son. His name's Christian. And then my oldest daughter, her name's Rylan. And then our second is Jerila. And then Angelique. And then we're like, what do we want her name to start with? And then we were like, how about an L? Like, let's do an L name because her dad's name's Leonard. So we're like, let's do an L. So we were trying to figure out, like, okay, what do we want to do? And we had, like, gone through Pinterest and we were looking for baby girl names, like, unique baby girl names. And then one night we were all sitting there like, Lovelynn. Like, Lovelynn's cute. Look at this. And we were, like, kind of looking and we had selected that one and we were kind of scrolling underneath that. And, like, Lovelynn's a cute name. Like, I like that name. For her nickname, we can call her Lovey. Like, there's so many different ways we could do this. So we're like, okay. And so we had settled on Lovelynn as her first name. And then we were trying to think of what we wanted her middle name to be. And we couldn't quite figure out what we wanted her middle name to be. And then on Christmas Eve, we had a like false delivery. What would you call it? Like false delivery, I guess. We went to the hospital and they're like, oh, like you're starting to dilate. Like let's go ahead and take a walk for a couple hours and we'll see if that progresses. So we're like, okay. So we walked around for a while, it didn't progress, and so they're like, okay, go ahead and go home and then let us know if you start to have like real contractions. Yeah. Like at that point it was probably just Braxton Hicks. So we went home, and then again on New Year's Eve, the same thing, where we were just like, what the heck? And I was like, it hurts so bad, like we gotta go. I was like, and they're closed. Like they were like maybe 8-7 minutes apart. And I'm like, let's just go and let's just see what they say. So we went, and then they were like, no, I think it's just Braxton Hicks. You're still only dilated 1 centimeter. Like you still got a ways to go. And then so because we had to go to the hospital on Christmas Eve and New Year's Eve, like let's just name her Lovelynn Eve.
Oh, pretty. And it flows very well. How has it been since she transitioned? Like how's it been for your family and just life after loss?
I think like it's been a little bit difficult. I think in like the very beginning it was hard because like our culture, being Navajo, we have like cultural beliefs and cultural things that we have to do when somebody passes. I guess in the way that I explained it to my mom and to my mom's family was like, it's different. The way we handled the way Lovelynn passed, I feel like we have some leeway because she was a child. Like she didn't get to live, as long as other people did. She didn't get to experience life. She was an innocent child who was put in a situation that, none of us could have, ever wanted her to be in. And so for me, the things that a lot of people told me and a lot of things that, like I had conversations about with her hospice team, with the hospital, with her team in Denver, like, like they had all told me, like, at the end of the day, like all other things aside, like this is your child. Like you do this how you feel like you want to do it, or how you think that she would have wanted it, because, it's your way of honoring her. And I get that you want to respect everybody else's wishes and everybody else's beliefs and whatnot, but like what's going to make you sleep better at night? Because you can't just do things because somebody's telling you that's the way that you're supposed to do it. The way that I advocated for Lovelynn through her whole battle is the way I had to advocate for myself and her loss. I was talking to my sister a couple days ago because my sister was one of the few people that like she came to see Lovelynn as much as she could. Like before Lovelynn was even diagnosed, like she would come to visit us as often as she could. And even in the middle of COVID, like we'd be like, okay, you guys are good. You guys aren't sick. Like you guys tested, like, okay, come over. And so they would, and they didn't live in state. They lived out of state. They came to see as much as we could. And I was talking to her a couple nights ago and I told her, I was like, the thing that bothered me the most in Lovelynn's loss, and I feel like, I don't know if you might have done this, but I pushed a lot of people away. Like I really set a lot of boundaries for myself because grief is hard. Like it's one of those things that just kind of happens, and sometimes it's triggered, sometimes it's not. And I feel like stress was one of the biggest triggers for me, dealing with a lot of unnecessary stress is the way I would put it. So I had to set a lot of boundaries for myself. And that's one of the things that she's always like, even when Lovelynn was going through treatment, she'd tell me like, you need to set boundaries. What are you okay with and what are you not okay with? Because you need to be able to say no, because you're in that position that you can say no and somebody shouldn't be mad at you about it. And I said, okay. I didn't really do it a lot during her treatment. I did it a lot after she passed away. I kind of was like, okay, you know what? I get that we have cultural beliefs. I get that we have traditions that we are supposed to follow. But to me, it's like, this is a child. Like, this is a baby. She she's not going to be able to celebrate any more birthdays. She didn't get to do, you know, what all of my other kids got to do. She doesn't get to start school. She doesn't get to graduate high school. She doesn't get to get her first job. Like a lot of these things that, you know, other people experience, she's not going to be able to do any of those things. So why should I, you know, have to follow all these strict protocols and do things the way that you guys want it done? Like the hardest thing for me was getting rid of her things, because in our culture it's you have 4 days of like cleaning out all of their items and getting rid of everything. Because my mom was staying with us at a time, I kind of let her, you know, because she, you know, she's been through loss. She lost my dad. She lost one of my nieces a few years before that, that she was her caregiver as well. And so, you know, and she was with us since Lovelynn was in hospice care. So she, you know, she's experienced quite a bit with us. And so I let her, you know, when it came to the toys and like the stuff like that, and I said, okay, fine, like let's clean it all off and let's donate it. And there was certain things that I was like, I can't get rid of these things. Like, you guys go do it. I'm going to go lay down or whatever. It wasn't until we started to like do her last load of laundry and I was folding her clothes and I said, nope, I can't do it. I'm not giving these away. I literally grabbed all of them. I said, I'm keeping all of these things. Those are the type of things that they told us, like, we're not allowed to keep. Like anything that she wore, anything that she touched, like those kind of things we weren't allowed to keep. And I said, sorry, I can't do it. Like, I can't. This is all I have left of her is the way I felt. Yeah. And so I kept a lot of her stuff, and my mom said, I understand. And so her and I made a quilt out of Lovelynn shirts and dresses and her sweaters. That was our way of keeping some of those things, but repurposing it for like something that we can still use. And it wasn't just something we were putting in a bag somewhere. Little mementos, like things that she really loved, like stuff that she held close to her. Like we held on to those things, and we have a wall in our living room that has all of her like her memorabilia, I guess is what you could call it. So we have all of those in like cases and stuff, and we have them put away, but they're like there to remind us, you know, like this is who Lovelynn was. I think we all, like, the thing that's been the hardest is to like really understand how everybody grieves. Everybody grieves very differently. I'm a very vocal griever. So like when I'm feeling sad or I'm feeling like I'm starting to feel triggered, like I will say like, you know, like I can't do this right now. I gotta step away. And it sucks because I don't know if it's like being embarrassed of my grief or being ashamed of my grief, because like when I go out to public and something, like if a song comes on that reminds me of her, I will immediately have to just turn around and start crying. Like I can't, it's hard for me to really like compose myself to like not show everybody that like why is she crying? Like I'm just like, oh my god, I can't do it.
I think sometimes even our own grief changes from time to time, and you know, sometimes I feel like I'm very open about it. Sometimes I just shut down.
Yeah, like sometimes it can be very debilitating to where you're just like, I can't even get out of bed today. Like there's days that are like that. And Lovelynn, when she was in treatment, she had this obsession with dogs, videos of dogs. We would scroll on TikTok, or not TikTok, on Instagram, and she'd see a picture, a video of a dog. She'd be like this with the phone right in her face, and she'd be giggling at the dog. Like, and so my husband would always joke with her, like, when you get home, we're going to get a dog. And I looked at him like, we are? You're like, taking care of the dog. Take care of this dog because I know she ain't going to, and you're not going to. My sister had puppies, and she was like, "Oh, we're giving this puppy away, so we're gonna bring him out so the people that are gonna take him can come get him." And we're like, "Oh, okay." And so she comes all the way to our house, and she's all, "They're not gonna take the puppy. So do you guys want him?" And we're like, "What?" And all the girls just got so attached to him. They're like, yeah, remember you said you're going to get Lovelynn a dog? So eventually we ended up keeping him. And we'll take him and we'll see how Lovelynn like deals with him. And if he's just too much for her, then, you know, we'll have to give him back. But we don't mind keeping him for a little while because we had to walk him all the time. Like we would take Lovelynn on walks with him, and he would like lick her toes, and she would just sit there and giggle. I didn't think animals could feel like a loss like that. And our dog, he grieved right along with us. And so it's so crazy because last night I was watching this video of Lovelynn where she was drawing on the iPad, and she was like, she'd make a line and she'd look at me and she'd cover her mouth and she'd laugh, and I'm like, oh, that's so pretty, that's cute, and I was like, oh, I like that, and then she would do it again. She'd draw another line and then she'd start laughing again. I'm like, what are you doing? And I was watching that video and I was like, oh, I upgraded my iPad. I thought that all of my stuff was backing up to my iCloud. And so I quickly went to my iPad. I grabbed my Procreate app and I checked to see if all my drawings were in there, and they were gone. And I was like, what the heck did I do? I went and asked my husband, I was like, did you delete everything from the old iPad? And he's like, yeah, we reset it completely. I was like, oh, all her drawings are gone. Every single drawing she did, they're gone. And I immediately just started.
No.
I started crying and I was like, I can't. It's like, that's just like one more thing that's gone. It's like, and I can't do it. Like, for me, it's kind of like I lost a piece of her. And that hurt because now that she's not here no more, like, I have to hold on to so many of these things because I can't get it back. She can't redraw any of those things. The cool thing about the cool thing about Procreate is that you could record the drawings, and that's the way all her drawings were, is that they were recorded, so I could play them back, and it was like I could see her drawing them again. That was so hard to like realize that they were gone completely. But I sat down on the couch and I was kind of like trying to Google, how can I get them back? Like, is there any way to retrieve these things? It looked like they were backed up to my iCloud because the iCloud was showing that it was backing it up.
Yeah.
But they wouldn't restore. And I was like, I don't get it, why they're not restoring. So I was sitting there and I started to like cry. And the dogs, they knew, like, they're like, oh, mom's sad. And they come and they both started sitting on me. And I'm like, I know, I'm okay. I'm okay. And Lovelin's dog, like, he's been the biggest support. Literally, since Lovelin's passed away, he's been like my go-to for if I'm feeling sad. There's days where it's just so hard, especially the month. May's hard for us because she passed away in May. And May's the month that we try to like advocate for, you know, like everything that she went through. And so I remember last May was really hard. Like, it was like I couldn't do anything. I was like, why am I even working? Like, I can't focus on nothing right now. And like, he was literally like at my feet for everything. Like, if he saw me even start to like shed a tear, he was immediately on me, like, hug me, and I'm just like, okay. And I would hug him and he would just let me. Like, he's been like the true, like the true emotional support pet. And he's like, just, he's been so good. And like, and we like, when Lovelynn passed away, he had a hard time. He looked for her a lot. When she was doing radiation, she had to wear her BiPAP machine to radiation. Oh. She wasn't allowed to come off of it. So we had to have something big enough to take her oxygen, her BiPAP, and all of her other stuff. She had this big stroller, and we would see kids riding around that stroller at the park, and he would cry to go to the wagon, and we're just like, oh my God.
He recognized it. He familiarized it with Lovelynn.
Yeah. And we'd have to tell him, that's not sister. That's not sister. Come here. Come on. And we'd have to hold him. And then eventually we would have to like let him go and smell to show that it wasn't her. And he like had the hardest time.
And that must have been hard for you too, because, you know, I'm sure you familiarized yourself with that wagon too. And just the dog do that. And I know for me, there's a lot of things that, you know, it immediately brings up Luna, like, oh, Luna, and it's hard, and it's like those waves of grief come back at that in those moments.
Yeah, my husband, he grieves a little differently. Like everybody else, like, they don't have a problem talking about her. Like, they could talk about her and giggle and laugh about her, like how she was, like, and it's so different because everybody saw her differently. Like, the way they experienced her is so different. And I think, like, as her caregiver, like, I saw a different side of her that everybody else didn't really get to see. Hearing other people's stories of her, like, I love that because they always remind me of something different. And that's the thing, like, that's been the hardest in grief, is, like, not forgetting things about her, not forgetting, like, especially the things that made her her, or, like, were, like, unique to her. That's probably the hardest because, like, there was something that somebody told me the other day and I was just like, I forgot she used to do that. Like,
and those are things too. I find myself too that, you know, and I think a lot of people, you know, don't understand, you know, you can have, you know, mom, dad, But whoever is the main caregiver, whether it's mom or dad, like, you see cancer, you see the brain tumor in a different light. You see everything differently. Like it's being the main caregiver is very different. You remember the pokes, the
Yeah.
pain, the surgeries, like all that stuff so vividly, and it's hard to remember the little, although you do still remember it, but sometimes someone will say something, I'm like, exactly like you just said right now, like, oh yeah, that's like, yeah, I remember that now. Like I can
Hmm.
now remember it. And
Yeah.
um it hurts sometimes that, sometimes that's why I always say I don't want to forget her. And sometimes I feel like I forget these things for that moment. And then someone says it, I'm like, yes, like I remember her saying that.
Yeah.
So I get that 100%.
Yeah, it's hard because it's kind of like as her primary caregiver, I think I remember more of like the bad days. I remember the trauma. I remember like the things that she had to really endure because not everybody was there for her, like in it with her the way that I was. Like I stayed in the hospital with her. Like I woke up in the morning. She was waking up the same time I did. I went to bed at night. In the morning, we were going to bed at the same time.
Everything the doctors were saying on rounds, everything that the nurses were saying, like I think that in itself is different. Like you can be told, oh yeah, we had a doctor's appointment and this happened, but all the little things and details that other people don't hear, and sometimes they stick with you for a while, and it's like you see how really fragile they are because people will come in and see, like you say, she was still dancing, she was still smiling, and people are like, look at her, like she's dancing, she's smiling, she's strong, but you hear the other end of how fragile they truly are because you're
Mhm.
there at doctor's appointment, you're there hearing the doctors in rounds having conversations of what the plan is and what has happened and where it's going, and you hear all that, the reality of it all in the big picture.
Yeah, like that was probably the hardest for us going through treatment is because she really did like unless you had seen her shunt, unless you had seen her G tube, unless you had seen her Broviacs, you wouldn't have thought that she was going through what she was going through. And a lot of people really were kind of like, it was hard because like you could see people kind of looking at her, like giving second glances at her. And it's kind of just like, for us, it's kind of like, why are you staring? Like, don't stare at her like that. And especially when she didn't have hair, her Broviac, like kind of, or her shunt
Yeah,
stuck out from her head. And so,
yeah,
like,
because the shunt goes
yeah.
over the skull under the skin, so it's really
Hmm.
when there's no.
Yeah. And so when she was bald, people would just kind of look at her like, what is that? And then like her neck was so skinny that you could see like the shunt coming down her neck, and it kind of just stuck out there, and people would just kind of look at her. And I'm like, I remember when we went on her wish trip. When we took her on her wish trip, she had like all of her equipment. Like we had, had to get
Yeah.
special approval to take all of her equipment with us, like her oxygen machine, her little sat thing to keep track of her oxygen in case we needed to like quickly check her or anything, her feeding bag, like all of that. Like we had to like have her little mobile station ready to go. And like she definitely did get a lot of like second glances.
Where did she go for her wish trip?
We went to Universal.
Okay,
Yeah.
awesome.
We had wanted to go to Disney, but I guess like they told us that Disney and California's Wish Foundation weren't like doing anything at that time. So
Because it
they're
was
like,
COVID. Yeah. Okay.
yeah, so they're like, we could do Universal, and we're just like, okay, like
Mhm.
I don't know if she's gonna be able to ride anything at Universal, but the kids will. So okay,
Mhm.
let's
Mhm.
go then. The first hour of us being at Universal, she pulled out her G tube. The ball was still inflated, everything, and we're like, how? I had to hurry up and call her hospice team and say, hey, we're taking her to Children's
Mhm.
LA, and we're gonna have to go get her G tube put back in because she ripped it out. That was like the most traumatic thing I've had to deal with away from home.
Getting inside from the park itself, getting out, and then parking, and then the traffic, because that
And
area.
we had walked over there because we stayed at the hotel down the
Oh,
street from
okay.
Universal. So we had to run back
Mm.
to run back to the hotel, get in our big old van that they rented us, and have to drive down to Children's Hospital. And I'm like, oh my gosh, is this van gonna fit down here? Like this it's like an activity bus. It was huge. She definitely figured out ways to just test us all the time. Definitely things that we said we wanted to do with her, like we were going to try to do with her. And so we're glad that like two of the biggest things we want to do with her, we got to do. It's still hard, like, especially now, like there's things that we do and we're just like, oh, Lovelynn would have loved this.
Yes.
Lovelynn would have enjoyed this. And that's hard because it's kind of like you don't get to experience those things and you're never going to be able to. And that goes back to that whole like, why? Why us? Like, why does this happen?
And I think a lot of us ask why, and I know I have voiced this on my page, and a lot of people tend to misinterpret it as like, oh, you're saying that you want another child, and it's like, no, that's not what we're saying. It's like, why did we have to, we wouldn't want anybody to go through it, but like, why did my child have to go through that? A sense of that we will never understand why.
Yeah, there's like many, especially with like how the world is today, and you see like all these little kids just going through some of the worst things that, that aren't cancer. And it's kind of like, that's not fair. And to me, that's the way like I start to feel that like, why? Like, that's not fair. Like, she didn't deserve any of this. Like, she was just and like that was one of the very first things I remember when we had gotten admitted to the specialty care unit after she was extubated and moved up to like where they do the oncology or the oncology floor. And I remember one of the very first things one of the doctors told me was she came in, she sat down and said, told me what her prognosis was, how much time she had to live. And then she told me, like, don't blame yourself. This is not your fault. And I immediately started crying, like, how are you going to come in here and tell me that's not my fault? When, like, I've been trying to figure out what did I do? How did this happen? And I like literally had a notebook and I was backtracking every single thing. Like, did I eat something? Did I do something? Like, can you get cancer from ultrasounds? Because we did a lot of ultrasounds, like, and it was just so hard. Like, what medicines did I take? What could have triggered this? Like, I went down that rabbit hole for nights trying to figure out like
And
where
even though you knew that it wouldn't change anything that was happening, it's like you don't want to be told it's bad luck or it just happened. Like you want to figure out like where it
what
happened.
triggered it. Yeah. I think for me, it was more like, okay, if I can figure out where it happened, I can tell people, don't do this. Like, whatever you do, don't stay away from this. Because that's where I was. Like, I was Googling things. I was like looking on Facebook for other groups and trying to figure out, like if anybody has figured it out. And I'm like, somewhere somebody has an answer. Like, this had to have come from somewhere because there's no way that it just happened to her. Why would it just happen to her? Like, she's just a baby. And that was where it was the hardest to like really like grasp, like accept it, I guess. It was hard for me to really accept that because nothing just happens for no reason. So I was under the impression, like something had to have happened, like something I did or something somewhere, and I need to figure out where because I don't want anybody else to go through this. Like, this is not fair.
And I think a lot where a lot of people also, think, well, it's the food, it's the environment. But the reality is now, at the beginning, we don't even ourselves know, but now we know it's like, it's nothing that we fed them. It's not their environment. Maybe for adults it is because, we've lived longer and
Experienced it.
been
Yeah.
exposed to it longer. But a child, especially a child that is only months old, that's only on breast milk, only on formula, it 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 it's not. Sometimes it's, we're dealt with bad cards, and again, we'll never understand that. And then I think people need to understand that cancer doesn't work like that way all the time, especially in children.
Yeah. And I think like that was one of the hardest things for me, like going through like treatment was we were offered genetic testing like several times, and I was up to it. I was like, okay, let's figure out what's going on. Let's see if I need to like be careful for my kids, like, you know, because they're women and they're going to have kids. And
Yes.
I don't want them to go through this. So, you know, maybe I do need to do the genetic testing. Maybe I do need to figure out, you know, is this just her, or is it something within my bloodline or his bloodline, or something that can eventually pop up again later on down the road. Lovelynn passed away that year in May. It's her third birthday. If she was still here, you know, we would have to buy her gifts. And I don't want her to be forgotten that way. So the way that I want to do that is I want people to donate in her honor. So we can go and, you know, take care of these other kids that are either stuck in the hospital or in hospice care, or their siblings. Because, you know, like that was the hardest thing for us is we want to start a foundation for Lovelynn, but it's like trying to really navigate all of that has been difficult, and try to really understand, like, because every state's different on what the
Hard. Yeah.
requirements are. A lot of places are kind of like, well, are you guys a nonprofit organization? We're just like, no, we're just us trying to like help spread the cheer. We've still just been doing it on our own, having people that support us and like still follow, because we have a Facebook page, and we still have people that still follow us there. They still donate toys, donate to, you know, in honor of Lovelynn. And so for her birthday, every year we donate toys to, you know, like other families. And for us, the hardest thing was when Lovelynn passed away. The hardest part about all of that was that the support disappeared. As far as like the organizations around us that told us, like, you know, we're going to be here for you while Lovelynn's in treatment, and we're going to do all of this, and if Lovelynn passes away and doesn't make it through, we're still going to be a support system for your family, we're still going to be here. And that hasn't been the case, and that was hard for us because that was when we needed the support the most. You know, like our kids needed somebody to talk to, our kids needed somebody other than us, because, you know, we're grieving ourselves, and it's hard for us to really have those conversations without us breaking down, and us, you know, not being able to fully respect that their grief is different than ours, the way they feel it's different. That was hard, because the only people that really like tried to help us navigate after Lovelynn passed was our hospice team. And they still do, like, they still reach out often. They think of our girls. Those are the only people that haven't really forgotten about us.
I see that time and time again, and this is something that I talk a lot about my page, is that it's like people want to root for that child that's going to ring the bell. You know, people want to be there and present. People don't want to see the truth and the reality that, you know, when a child doesn't get to ring that bell and
Mm-hmm.
the child transitions, it's like people let go of the family once the child passes and they move on to the next child. And they don't understand that that support is still needed, because we felt that too when Luna passed. We felt how, you know, as we entered our grief, at the beginning there is some people that are there present, but slowly it just kind of, that support and that presence of people starts kind of dwindling, and not only just family and friends, but also organizations that don't really want to focus on that. So when we founded Luna's Everglow, that I said bereaved parent, bereaved families is a huge part of
Mm-hmm.
where I want to focus. So that's something that, you know, we're little by little trying to make projects for and working with the hospitals, because I don't want families to feel like that. And that's why when I hear of these families, you know, going through that, are either put on hospice or having a hard time with their child, like, and I feel like my Luna pushes me to kind of connect with these people, because I know, and I've walked in their shoes, and I know what is to come, and I never want them to feel alone. I never want them to feel like nobody's there for them,
Mm-hmm.
because the majority of that support does go away when,
Yeah.
you know, your child passes.
Yeah. And that was like a kick in the shin for us, because we were kind of like under the impression, you know, like when you have these first meetings and you have these introductions to these organizations, they tell you like, oh, we're going to be here from you during and after, and, you know, all the way, like, we're going to be there to support you. And then so when they all kind of just dropped back, we were like, wow, like, where do we go for like grief support? Like, what do we do for this, or what do we do for that? Yeah. And I think it's like in our positions, we've experienced these things and we've felt that disconnect, or we've felt that lack of support in certain areas, that now I think as caregivers ourselves, in a way, we're still trying to care give, I guess. And it's kind of like, but we're doing it because we feel like, I don't want somebody else to feel the way that I felt. I don't want somebody else to feel like they're just forgotten because their kid's not here anymore. Even though I'm sad, that doesn't mean that you have to feel this way, or that you have to cushion how you feel because of me. Like, I want you to be able to talk to me about this. I want you to be able to be open with me about this, because this is not, it's not easy. I know if it's not easy for me, I know it can't be easy for you. And I want you to talk about her. I want you to tell me, how you're feeling. My Angelique, my youngest now, she'll tell me like, oh, I had a dream about her last night. And I'm just like, what did you dream about? And I always like to hear those, because like when I dream about her, I don't ever see her face. Like, it's always like her body, like I can see it. But when I like try to, like, in my dream, when I try to like look at her, I can never see her face. And it's always like, why? Like, why doesn't she show me herself? Like, I'm trying to figure that out. And like, it's weird, like the things that trigger my dreams for her. Like, if I'm like really, like, there was a time right after she passed away that I got really depressed, like really, really depressed, to where like I had like dark thoughts. And I remember one night I went to bed and I was like telling myself, like, I don't even want to wake up tomorrow. Like, I don't care. At this point, like, I don't care. Like, I just want to be with her. And I remember that night I dreamt about her, and I woke up that morning and I like did not want to wake up because I dreamt about her. I'm like, oh, why?
Like, you want to stay in that moment,
Yeah.
even if it's just a dream.
Yeah.
What advice would you have for parents that are newly diagnosed or that are just starting?
One of the very first things that I was given was a notebook and a pen. And I was told, here's this. You can use it however you want. If you want to jot down things, or, write yourself a journal or whatever it is, here it is. And it was a little tiny notebook. And I used that to start noting everything, because there was things that, like, I wanted to be able to remember. Like, if she felt this way, what did it mean? If she felt that way, what did it mean? What are all of these terms? Because you're thrown like white blood cell counts, neutrophils, like all these things, and you're just like, what is that? Like, what does that mean? And so, like, kind of writing those down and trying to like keep track of those things, because that was like, you're in a whole different world when you step into this, and like kind of finding your way of navigating those things and notating those things that you don't want to like be confused about, or like you don't want to get caught not knowing certain things. Like, those are the kinds of things like I would write down. Take as many pictures as you can, as many videos as you can, because like, I mean, even if they do survive this, like, you still want to be able to have some kind of like, this is where you were and now this is where you are. Surround yourself with support, because it's funny how you find support in the most random places. And I think for us, like, for me, I really went to social media. Like, when they told me that ATRT is very rare, only this many kids get it, and it was like 1 in every 100 or 1 in every 300 or something like that. So I was like, wow, like, it's really rare. Like, and then like you think about it, like, wait a minute, there's a lot of people in this world though, so is it really? And so I went to Facebook and I tried to find ATRT groups, and I found some. I went to Instagram and I searched hashtag ATRT, and I found so many, and I was like, it's not that rare. It's not that rare at all. Like, and so I found hope in people that were like in the fight, and they had, they were no evidence of disease for so many years. And I'm like, okay, so then she can beat this. Yeah. She can live past the age of 2 or 3, because the way they made it sound was like she had a year to live, is the way they made it sound. And so when I found all these other families that have 3-year-olds, 4-year-olds, 5-year-olds, I'm like, so it's possible. She can live a little bit longer. Okay. like, what are they doing? How do I go about that? How do I get that same kind of result? And it's so hard because no kid is alike. Like, then that's what you sadly figure out once you really get into the depths of it, is that what Lovelynn went through, nobody else is going to go through, because they all handle it so differently, from the chemo to the radiation to, you know, the whole treatment plan. Like, and then they tell you, when we got diagnosed, they told us there's only one treatment plan, and this is the only one, and this is the one you're going to be on. And we're like, what? Okay. And then now, like 2 years after she's passed away, it's like you see all these other people on this plan, that plan, and I'm like, what? There was all these options and we weren't given them? And that
is that you didn't know any better, and you know it's not your fault. That's the reality of it, that you're thrown into a world that you know nothing about, and then you have to learn it like overnight, pretty much. Learn about the diagnosis, learn what you can do, and sometimes it's a lot to even, you know, sometimes you just shut down and you're like, you want to just be there and be present for your child because that's who needs you in that moment.
Yeah. I think like during all of it was when she was awake, my attention was there. Like, I'm here for you. I'm going to do whatever you need me to do. If you want to cuddle on the chair for 8 hours straight, let's cuddle on the chair for 8 hours straight. If you want to get markers and draw all over yourself, fine. Let's get markers and draw all over yourself. So like, I think that was one of the biggest things that I really tried to embrace, was putting the phone down, or putting, you know, certain things aside and focusing on her, especially during treatment. Literally all she wanted was me. And it was kind of like, okay. And there was days where I felt exhausted, but towards when she was put in hospice, I would tell myself, like, I don't care if I don't sleep tonight, because as long as she needs me, I'm going to be up for her. As long as she needs me to do this, I'm going to do it for her, because who knows how much longer I'm going to have to do this. Who knows how much longer her and I are going to stay up till 4 o'clock in the morning watching Coco Melon. Like, and so, you know, like, I really did embrace those things, and I probably embraced it too much, because like towards the end, like, I was getting 4 or 5 hours of sleep a night, and that was it. But I was functional though, and that was where I feel like maybe my body was like, you're doing what you need to do right now. We're good with 5 hours of sleep. Let's take the 4 hours. Yeah. So like, even now, like, if there's somebody will ask me, like in our ATRT group, they'll ask, you know, when you guys did this, how did this go? And I'll go through my little notebook and I'll try to find the day that I know something happened, and I'll be like, okay, this is what happened, this is what she took, this is how it all went. Like, to be able to like help other families, I think that notebook has helped a lot. And so like, keeping notes, pictures, videos, spending as much time with her as I could. Sadly, in this space, tomorrow's not guaranteed, and that was probably the hardest thing to accept.
And I think it's like that, you know, for anybody. We don't know what tomorrow brings, but it's even more fragile in the cancer world. That's why, you know, we advocate and raise awareness, because we want people to understand that it can happen to anybody.
Yeah, definitely the thing that was the hardest to really understand, because I had 3 healthy kids before Lovelynn. And then, so to have to navigate this route, it was kind of like, what? This can't be real. Like, this is just doesn't make sense at all. The thing that was the hardest for me transitioning between all the hospitals and hospice care was like, who's our go-to person? Like, who's the person that's going to be there for us? And so we had to like make all those people our people, because you don't know like what kind of wealth of information each one of these people can have, and what kind of experiences they've had, or how they would navigate certain things. So having 3 medical teams that we had to like buddy up with, building those relationships, because that was the thing that I needed to really embrace, was that they're only trying to help us cure her, if that's even the option. Listen to your gut instincts, because nobody knows your kid more than you do. You know, every doctor can have every degree in the world, and they could be doing this for years and years and years, and seeing kids come in and out of their, you know, their rooms. But at the end of the day, they haven't seen your kid, and only you can advocate for them. Only you know what is okay with them and what's not okay with them. One of the things that really helped me build my voice is because before Lovelynn, I didn't really know how to, advocate, not even just for myself, but for anybody else. And with Lovelynn, it was kind of like I didn't have a choice. I had to. If she wasn't if she was uncomfortable with something, or if she was hurting, or something was, it felt like it was doing more damage than good, advocating for her and speaking up because she couldn't. And being able to say, like, I know my kid and I know that this isn't normal, or I know my kid and I know that this isn't comfortable for her. Be that voice, because it's going to come in handy in the long run, because you're going to have to do that quite often.
Mm-hmm.
And being able to say no. Like, you have, even in the medical situations, you have that right to say no. You have that right to say, you know what, I don't want to do this.
Mm-hmm.
Second opinions are always an option. Asking somebody else for another opinion definitely has helped so many times for us, because there's times that we don't know better. Like we've said, like, we're not medical experts. We're just a mom who loves our kid, and there's going to be times where you're going to second guess what somebody's saying, not because you don't believe their judgment, but because you know your kid.
Yes, most definitely. I agree 100% with everything you said. Thank you so much for coming on here and trusting me to share your daughter's story. Lots of good things that were said here that I think it's important for other people to hear. So thank you so much for sharing Lovelynn with us. She seems
Yes.
like such an amazing, amazing little girl.
Yep, she definitely was.